The PACT Coalition uses a variety of different approaches as we look to create community change in Pelham, supporting youth to make healthy and substance-free choices. Positive youth development has been shown to be effective at really growing those strengths within our youth by surrounding them with experiences, uh, relationships where there's good role models and environments that are positive and that are supportive. Youth can develop strong quality traits, um, be competent, make connections, be connected to their community, have confidence, have character, make contributions, and are caring individuals. The strategic prevention framework is a process that's required by our grant funding through the Drug Free Community Support Program, but has really been shown to be an effective way for communities to come together to plan, to understand what the issues are, to reduce risks that youth face, increase those protective factors that help kind of support them um, against some of the risks in life, um, and really to promote positive youth development. So the first step in this planning process is assessment. And this is where we collect data. We really try to understand what our community is about. We understand what individuals play a role in our community and what resources that we have available, and maybe the gaps that we need to try to fill. The next step is capacity. We need to mobilize individuals, we need to engage the community, we need to access financial resources, in-kind resources to support the work of the coalition. Planning is critical. It needs to be thoughtful, it needs to be strategic. We need to look at those conditions that we've identified in the assessment process, coupled with the capacity of who can handle some of these strategies or changes, who can take the lead, and implementing a wide variety of things from policy changes to specific programs targeting kids, or parents in their education, enhancing their skills to really address the problems that we've identified. Next, we implement effective and evidence-based prevention programs, change policies and practices. And then finally, we evaluate to make sure that the programs that we are implementing and the strategies we're using are actually making the change that we're hoping they will make. And then you continue to circle around. And in the middle is sustainability and cultural competence, two pieces that really need to be integrated along the way. We want to make sure that we're reaching all the community that we're serving, and that our content, our programs, our strategies are sensitive to the different cultures and ethnicities in our community. And we want to make sure that these strategies and that we implement are sustainable over the long haul. 7 strategies for community change. These are kind of understandings of different ways that we can approach community change, having all of these in our plan so that we are effective at changing our community at multiple levels. The first 3 strategies are individual strategies. They aim to kind of change the behaviors or thoughts of the individual by providing information, whether it's through educational presentations or workshops, PR through the media, enhancing skills. Maybe it's teaching students resiliency skills or parenting classes or supporting teachers, providing support systems, whether it's maybe an after-school program or a parenting group, something that really helps individuals to come together. These three strategies are really targeted to the individual, whether it's a parent, whether it's youth, or possibly a community leader. The next four are environmental strategies, and these are been shown to have a greater impact on the larger population. First, to either enhance access or reduce barriers so to service or treatment, or providing childcare so someone could come to an event. Reduce access and enhance barriers. We want to limit the availability of alcohol, tobacco, and drugs by maybe it's compliance checks to ensure that our community is not serving to minors. Changing consequences, making incentives for good behavior, and disincentives, I guess, for bad behavior. Changing the physical design. If we add lighting to places that are dark, it may deter youth from hanging out. If we move cigarettes to behind the counter, it will deter them from purchasing them. Those types of strategies are effective. And policy change. These can be informal and within an organization, such as bylaws or procedures, or they could be laws that influence the greater community. And these are really kind of much more sustainable types of strategies. Positive Community Norms Framework comes to us from Montana State University, and we brought them in last year for a training for our coalition. And the idea is that we're really going to foster cultural transformation. It addresses across the social ecology, different audiences, and it's a positive approach and really focuses on growing what's good in the community, rather than always the focus on sometimes the negative. So this is the framework. You have leadership, communication, and integration, all important, and all cross over the social ecology, so influence the individual, families, workplace, schools, community, and results in an increase in the positive community norms, and changing how the community thinks about some of these different social issues. So the positive of positive community norms comes from the science of the positive from Jeff Linkenbach. You start with the spirit, the why. The why are we here? What's our purpose? And what are we connecting to? And it's a hopeful, it's an energy. It helps to connect all the people in the room for a purpose. Our kids are a purpose in their health and their wellness, and it's a great way for us to engage many people in our work. Because so much of our community is built to support the families and the kids that we have here in Pelham. The next step is science, to really look at what's been researched, what's proven to be effective, be very intentional with what we choose and what we do, something that can be replicated. And then we do action, and to really create change and to cultivate a deep, lasting transformation. The idea of this approach is to really change how we think about something, and to change from a caterpillar to a butterfly. You can never go back. An example is smoking on an airplane. We will never go back to allowing people to smoke on airplanes. We have changed. We're fundamentally different. We think about smoking in a completely different way today than we did 20 years ago. So the leadership part of this positive community norms framework is that we need to lead people to make these healthier, safer choices. Prevention is all about active leadership, and if we want to be successful at prevention, we need to develop strong leadership skills. Communication. making change in a community, changing cultures is all about communicating and how we talk about the issues and think about the issues, and how we present what it is that we're trying to accomplish. And if we can share a commonality in how we communicate what we're doing, we'll be able to transform the cultures and some of the beliefs and values in our community. Integration. Fortunately, there's no silver bullet, one single solution to youth substance use. So we need to develop a portfolio, if you will, just like we develop financial portfolios. We have different pots we put our resources in, so that hopefully, if some are not as effective, others will be more effective, but that we will have an integrated approach to change. So the community part is the social ecology theory that recognizes that many forces operate in our culture, to influence our behaviors. And this is why it's so important that we influence all these different areas, because they all have a real impact on youth decision making. Finally, norms. Social norm theory tells us that people often do what they think is most popular. Um, Social norms are defined as the behavior or attitudes of the majority of people, and perceived norms are what people think the norm is. Often, people overperceive unhealthy behaviors. So students will say, everybody drinks, so I am too, when reality is most kids are not drinking. So this approach tries to close the gap between what is perceived norm and what is the actual norm. And as you close the gap, behaviors actually start to change.